Okay, so good afternoon, friends. Today we are going to see another vector-borne disease, that is malaria. It is very commonly asked in UG exam. Malaria is common disease, so it is commonly asked in your exam also. So pay attention well. So as you know that here in the slide you can see the picture of mosquito. Malaria is again a mosquito-borne disease. It is transmitted by mosquito. Do you know the name of the mosquito? Which mosquito transmit the disease? Right? Which mosquito transmit the malaria disease? Write down in chat box. So here mosquito is considered as the vector. So it is vector-borne disease, right? So for example, apart from the mosquito, you know that other vectors, not particularly for the malaria, but I am telling you about the other vector like housefly. Housefly is also a vector. Rat is also a vector, right? So here in case of the malaria, dengue, these are mosquito. These are the vectors. So if you know the name of the mosquito which transmit malaria, write down in chat box. Which mosquito transmit malaria? Till then, we are going to see what is vector. A vector is defined as an arthropod. It is an arthropod or any living carrier that transport an infectious agent to the susceptible individual. Or in simple words, we can say that a vector is any living organism which transmit infection from one organism to another organism. That is called vector. From one human being to another human being, that is vector. So here mosquito transmits malaria, dengue, chikungunya from one human being to another human being through mosquito bite. So this is called vector, right? So yes, plasmodium. Plasmodium is the parasite. I'm telling you, I'm asking the question, which mosquito, name of the mosquito. Plasmodium is not name of the mosquito. Plasmodium vivax or Plasmodium simply it is parasite which is the responsible for malaria. So vector can transmit infection by two forms, mechanical form and by biological form. For example, mechanically, for example, housefly which sits on the waste, particularly food waste or garbages. There it sits and it rests over that. So the organism responsible for the transmission of the GIT infection, like Vibrio cholera, that say Salmonella typhi, that gets attached to the body of the housefly, particularly over their legs, and then this housefly, whenever it comes to our kitchen food or any food we eat, it rests over that and it transmits that organism, microorganism, staphylococci or Vibrio cholera to our food. That is called mechanical transmission. Means here microorganism which cause disease are transmitted from the garbages to our food through the body of the housefly, through the legs of the housefly. So that is called mechanical transmission. Second is biological transmission by vector for vector-borne disease. So biological transmission means here, for example, in case of the malaria or dengue, mosquito, during the mosquito bite, it sucks the blood from the human being. So the organism or parasite, plasmodium, you have already told Plasmodium vivax or Plasmodium falciparum, which goes into the body, inside the GIT, inside the gut of the mosquito, where it multiplies as well as it changes its form, right? It changes its form as well as multiply. And again, whenever it bites to the another human being which is healthy, it transmits this this change form, right, to another human being. So it is called biological transmission. Here, multiplication as well as change in the form of the parasite occurs inside the body of the vector. So that is called biological transmission. Well, in case of the mechanical transmission, there is no multiplication inside the body, or there is no change of the form of the organism inside the body of the vector. So that's called mechanical transmission, right? So yes, female Anopheles. So it is correct answer. Anopheles is the mosquito which transmit malaria. Right? So that is a difference between mechanical as well as biological transmission. So epidemiological classification of the vector by vector is invertebrate type. So in malaria, we are going through about vector also. There are two types of the vector. Invertebrate type means who do not have vertebral column, and vertebrate types means who have vertebral column. So this mosquito, housefly, these are called invertebrate type of the vectors, as well as vertebrate type of the vector. Those who have, like the monkey, they have the vertebral column, that can be considered as the vertebrate animal. By transmission chain, so main to non-vertebrate host, right? Like malaria, main and non-vertebrate host, like malaria, schistosomiasis, main vertebrate, non-vertebrate host, right? Transmission chain is from non-vertebrate host to main, actually, here in malaria. So here main to vertebrate to non-vertebrate host, plague and encephalitis, main as well as two intermediate hosts. So in this, certain diseases like fish tapeworm infection, zoonosis, right? So in this type of the infection, two intermediate hosts are required. Generally, you know that there are only one intermediate host before the main gets affected. But here in case of the fish tapeworm or clonorchis or paragnomesis, right? So these are the examples where two intermediate hosts are required. Then third classification of the vector is by the method in which vector transmit the agent. By biting, like in case of the mosquito, it bites and it transmits the infection. By regurgitation, right? By scratching, like in case of the rat scratches human body and it can transmit the infection, right? By contamination of the host with the body fluid of the vector, like rat urine, right? So if human body comes into the contact of the rat urine, that is the body fluid of the rat, right? So it can transmit the infection also. So by method, by biting, regurgitation, scratching, contamination of the host by body fluid. By method in which vectors are involved in transmission and propagation of the parasite, mechanical transmission, biological transmission, I have already explained to you. Factor which influence the ability of the vector to transmit the disease, host breeding preference, like female mosquito transmit the infection. You have already answered that male mosquito do not transmit infection because female mosquito need blood. Female mosquito always bite. Only female mosquito bites. Right? So here in the mosquito also it is female who bite. Right? So host breeding preference here is female mosquito. Male mosquito feed on the leaves or any of the vegetarian that leaves or stem of the trees. Right? Infectivity, susceptibility, survival rate. If the survival rate of any organism or any vector is more, it can transmit infection for the longer duration of the time. Right? Domesticity, like if the mosquito are prevalent in particular area, like in case of the Gujarat, mosquito are more common. So it is domestic, it is considered as the domestic vector. So here malaria and dengue is more common in Gujarat. Right? Suitable environmental factor. If the environmental factors are suitable for any vector, it can transmit infection at a higher rate. Right? So about malaria agent, you will agent factor. So these are the causative agents, not vector, right? Causative agent like Plasmodium vivax. So 4 types of the Plasmodia are there, which are the agent factor for malaria: Plasmodium falciparum, Plasmodium malariae, and Plasmodium ovale. Again, I repeat: Plasmodium vivax, Plasmodium falciparum, Plasmodium malariae, and Plasmodium ovale. Reservoir of infection is human being. So it is there. If after the infection we reserve this and we have this organism till it's get cleared, and if another mosquito bites again to any human being who is suffering from malaria, this Plasmodia gets into the blood of into the GIT of that mosquito. Right? Again, I repeat the names of the agent factor. Remember this: Plasmodium vivax, Plasmodium falciparum, Plasmodium malariae, and ovale. Most common here, vivax is seen, right, followed by falciparum. This is the life cycle of the Plasmodia. You can see that it looks complicated, but if you read it by step, it is easy to remember. So whenever the mosquito bites, so here we will read from one number. Mosquito takes a blood meal, right? Mosquito takes a blood meal and it transmits infection to human body, right? So then there are mosquito stage. Mosquito takes a blood meal, it ingests gametocytes. These gametocytes of what? Of the Plasmodia. It is changing into different forms inside the mosquito gut, like macrogametocytes, microgametocytes, then ookinates, oocytes, and mosquito then rupture it liberates the sporozoites, and whenever the mosquito bites again to another human body, sporozoites comes into the blood of the human body. Right? In human body also there are two cycles: exoerythrocytic cycles and erythrocytic cycles. Erythrocytic means inside the liver cell. This cycle is inside the liver. Right? So you can see in the liver cell is also gets infected. There is formation of the cyzones. Right? And in erythrocytes, in RBC, there are tropozoid form. This mature tropozoid, cyzones, ruptured cyzones. Right? So inside the RBC also there are development of the plasmodia. So plasmodia develops inside this mosquito, right? Inside this mosquito cycle, and plasmodia also develops inside the human body. In human also there are two cycles: exoerythrocytic cycle and erythrocytic cycle. So this is life cycle of the plasmodium, right? Period of communicability, right? As long as the mature viable gametocyte exit in the circulating blood in sufficient density, in means whenever these viable gametocytes are present in mosquito, they can transmit infection for their entire period, right? So criteria for the transmission of the infection, this gametocyte, both sex of the gametocyte should be present inside the mosquito, and only then it can develop, sporozoites can develop, right? Mature, it should be mature, gametes should be mature, viable, and in sufficient density. So if it is in both sexes in sufficient density are available inside the mosquito, then it can develop into the sporozoid and transmit infection to human body. Relapse can occur 1 to 2 years after the for the falciparum. Whenever, it means, what does it mean? Whenever we have the Plasmodium falciparum infection, malaria by Plasmodium falciparum, we take the medicine, it gets cured. Again after 1 to 2 years, up to 1 to 2 years, there can be again relapse. There can be again relapse within 1 to 2 years. And for Vivax and ovale, it can occur for more than 3 years also. Host factor, all ages are equally susceptible. It is not so that malaria is common in childhood or common in old age. All ages, malaria can occur to any person. As you know that it is transmitted by mosquito. So there is, mosquito doesn't see the ages, right? But you may have marked that whenever children have more mosquito bites, right? We have also seen that children have more mosquito bites as compared to transmission of the infection is equal in all ages. Because male are commonly working in outside environment and in farming also, so that there are more chances that male get mosquito bite and they may have a chance of the malaria. Then this Australian antigen, if it is said to be resistant against falciparum, right? If anybody is having HBsAg positive, Australian antigen positive, hepatitis B positive means, so that person may be resistant to falciparum. Duffy negative RBC, they are resistant to Vivax. Intrauterine death in pregnancy can also occur, right? Low socioeconomic development, they have the more chances. Persons who are residing in the lower socioeconomic class in Charlie as well as in that hurt area, they may have more chances because of the poor hygienic condition of getting mosquito bite and getting the malaria. Poor housing condition, poor sanitation, poor hygiene, right? So these are the factors which can lead to have the more chance of the mosquito bite and again infection. Population mobility, migration factor. So from industrial area to village area, people are migrating. The migration, like in case of the lockdown, there was lots of migration. So they can carry this plasmodia along with them in their blood, and in that area, mosquito may get infected. Agriculture practices, yet human habits, like these practices, agriculture practices and human habits, such as that it allows the water collection, like in case of the industrial area or like in construction area, water collection can lead to the more development of the mosquito. In agriculture also, water collection during the irrigation, it leads to the development of the mosquito, and simultaneously it can lead to the development of the vector-borne disease like malaria and dengue. So host factor, we have seen that intrauterine death, right? Such type of the housing where water collection is there nearby, Immunity, repeated exposure may give the immunity, but it is not sure that once you have the malaria, you will be protected lifelong. It is not sure, right? So you may have malaria attack many times. Maternal antibody is present in infant up to some time. Right? Environmental factor season, most common season is July to November. So that is the post-monsoon season. Why post-monsoon season? Because after monsoon, there is lots of water collection, and in water collection favors the mosquito development, and so that mosquito bite occurs more frequently, and it can lead to the transmission of malaria. Optimum temperature 20 degree to 30 degree centigrade. Rainfall, it favors the breeding of the mosquito, development of the mosquito. Humidity, it can lead to the length of the life, right? If more humidity is there, then life of the mosquito is more. High altitude, maybe lower in frequency over the high altitude. Man-made malaria, one thing is there, one terminology, man-made malaria, right? Why it is called man-made malaria? Like our habits, I have already told you that our habits or our process, such as garden pools where water collection is there, irrigation channels in agriculture, or engineering project where, or construction site where water collection is there. So we have artificial water collection by our human activity. It can lead to development of the mosquito, more breeding of the mosquito, and so that there is a repeated mosquito bite, and it can lead to malaria. So vector of the malaria, you already answered, female Anopheles mosquito. There are 45 species of female Anopheles mosquito. Right? For rurals, it is Anopheles culicifesis. Remember this two only. No need to remember 45 species. Right? For rural, Anopheles culicifesis and Anopheles stephensi is for urban malaria. For rural malaria, Anopheles culicifesis, and for urban malaria, it is Anopheles stephensi. Right? Factor density, if the density is more, then critical density is there in our area. Lifespan is 10 to 12 days after the blood meal. Choice of host, it is anthrophilic, right? So just remember here to name only this. So breeding place is here moving water for all these Anopheles. Clean water, rather we can say that clean water is the breeding place where they lay their egg. Anopheles mosquito lay their egg in clean water. Right? Time of biting, night biting. These are the night biters. See, dengue mosquito, the mosquito which transmit the dengue are day biter, and mosquito which transmit malaria are night biter. Right? Mode of transmission, vector transmission is through mosquito bite. Right? So this is the most common mode of the transmission, mosquito bite. Another mode of transmission of the malaria are by blood or plasma. So if anybody is having the blood transfusion and that blood contains plasmodia parasite, right, then it can transmit infection to those who is recipient. If the donor blood is containing this plasmodia parasite in the blood, then recipient can have the transmission of the infection, right? So most common mode is this vector transmission, that is mosquito bite, as well as congenital malaria. So if any mother is suffering from malaria at the time of the delivery, then the offspring, the newcomer, the child, infant, newborn, whatever you call, he or she may have also malaria. That is called congenital malaria. But these are rare, right? This is the most common by mosquito bite. Incubation period are different for different organism. For Plasmodium vivax, it is 8 to 17 days. Plasmodium falciparum, it is 9 to 14 days. Plasmodium malaria, it is longer, 18 to 40 days. Plasmodium ovale, 16 to 80 days. If you remember for these two, it will be okay. Plasmodium vivax and Plasmodium malaria, 8, 9, 17, 14. Now, clinical feature of the malaria. There are different stages of the malaria. First of all, cold stage. Here in cold stage, the symptoms are lassitude, headache, nausea, chills. This is the particular feature of the malaria, chills, followed by rigor. Right? Chills and with rigors. Cold skin, it is the cold stage. So here cold skin and rapid weak pulse. Lassitude, headache, nausea, chills with rigor. Right? Then hot stage. In hot stage, there is hot skin. You can see that in cold stage, there is cold skin. In hot stage, there is hot skin. Headache, common in both the stage, and rapid respiration. Sweating stage. So profuse sweating, skin cool and moist, and followed by a febrile period. So in what stage there will be fever? It is not written, but you can say that there is fever. Followed by a febrile period means there is no fever. Afebrile means no fever. These stages are followed by a febrile period. So here in malaria, classical feature of the fever is intermittent fever. Right? One day there will be fever, second day there will not be. After 1 or 2 days there will be again fever. So intermittent fever, chills with rigor. These are the classical features of malaria, which is the suggestive of the diagnosis. So diagnosis by clinical feature, whenever any patient is suffering from this such clinical feature, intermittent fever with chills and rigor, headache, nausea, vomiting, we prescribe what? PSMP, PSMP, that is peripheral smear for malaria parasite. Whenever after passing your UG, you will be sitting in OPD, you have to prescribe this PSMP, that is peripheral smear for malaria parasite. That is same as demonstration of the parasite in blood. So you ask to laboratory technician to take the blood smear and see whether the malaria parasite are present in blood or not. If they are present in blood, it will be of the 100% sure that patient is suffering from malaria. So for this, there are two types of the blood film are made: thick film and thin film. Laboratory technician will make two films: thick film and thin film. Thick film is for search of the parasite, and thin film is to identify the species. You know that parasite are plasmodia, but which plasmodia? Plasmodia vivax, plasmodia falciparum, plasmodia malariae, or plasmodia ovale. So for that, thin film will be helpful to identify the species. There are other tests which are of theoretical purpose, but only you can see that with this test, it will be 100% diagnosed. There is another test, fluorescent antibody test, that is for only epidemiological studies, not routinely prescribed. There is one, let us dipstick assay or rapid diagnostic test, RDT. You can say that RDT. It is same as pregnancy test or currently available antigen test for COVID. Same as that. Within few minutes only, the result will be available. Short form is RDT, full form is rapid diagnostic test. Rapid diagnostic test. Like here, rapid antigen test is available in COVID. Like the same here in malaria, it is rapid diagnostic test. Within few minutes only, result will be available. Right? So it is commonly used in place of the PSMP. So for control of the malaria, management of the cases as well as active intervention are to be taken. Management of the cases for according to the symptoms, and anti-malarial drugs are to be given. And for disease control, case detection and treatment. Right? So you can see that for this high risk area, right? Remember that this drug tablet chloroquine. Previously, it was so that presumptive treatment was given, but after 2013 guideline, after checking only malaria parasite, whether they are present in blood or not, or after having the rapid diagnostic test, only chloroquine is prescribed. Right? So any patient is suffering from fever or chills, intermittent fever with chills, prescribe this RDT, rapid diagnostic test, or PSMP. If it comes positive, then you can start tablet chloroquine. 600 milligram day 1, followed by day 2 600 milligram, and day 3 300 milligram. This is the course. Day 1 600 milligram, day 2 600 milligram, plus day 3 300 milligram. Along with chloroquine, primaquine is also started for 14 days, not only for day 1, it is for 14 days. 45 milligram of the primaquine. Here it is somewhat different, that on day 1 15 milligram followed by 15 milligram for day 5 days, but routinely 15 milligram for 15 days is to be 14 or 15 days is to be prescribed. Right? That is for radical treatment. That is the radical treatment that eradicate the whole form of the parasite. Low risk area, no, only not day 1. It is same as this high risk area. Right? Just remember only this part. In case of the severe or complicated malaria, quinine injection is to be given, but in place of that, we have the better drug artesunate derivative, that is artemisinin, artesunate, artemether, and arteether. Remember this. In place of the quinine, this drug artemisinin derivatives, right? Artemisinin, then artesunate. Only first remember the names. artesunate, artemether, and arteether. They are to be given in severe and complicated malaria, particularly caused by Plasmodium falciparum. This is no need to go through this. So this doxycycline is also helpful. These are the photographs of some of the pictures of the drug. Toxic hazards of the drug. For chloroquine, it may cause nausea. Particularly, chloroquine is very much toxic. It may cause nausea, vomiting, right? On short-term use, on long-term use, particularly chloroquine has the other uses also. So on long-term use, it may cause blurring of the vision, headache, retinal changes. If it is given, chloroquine injection is to be given, then we have to ask the patient to sit in our OPD to see any blurring of the vision or retinal changes. Primaquine may cause CNS, GI disorders, disturbances like nausea, vomiting, cardiovascular manifestation. It is contraindicated in pregnancy, right? Primaquine. So chemoprophylaxis is to be, yes, again one more thing, primaquine is to be not to be given in G6PD deficiency patient. And G6PD deficiency patient generally come to your OPD with the list of the drug that I am suffering from the G6PD deficiency, so do not give me these drugs. Patient gives the list to you, right? So in that list, this primaquine is also there. Chemoprophylaxis may be given, means prophylaxis against the malaria, well, so that malaria cannot happen to soldier, police. It is theoretically written over here to traveler, particularly travelers, here foreign travelers. So those who are coming to India, and India is malaria endemic zone, right? So from America or other country, those who are coming to India, that is from non-endemic country to endemic country. So they are given chloroquine prophylaxis weekly doses of the chloroquine, so that they do not get the malaria. Again, I repeat, India is malaria endemic area. America is malaria non-endemic area, means malaria is not present there. If you ask the doctor of the America that how to treat malaria, they may not be knowing, right? So if any traveler come from America to India, prophylaxis of the drug, chloroquine prophylaxis or other drugs like proguanil, mefloquine, doxycycline, they are used, but commonly chloroquine weekly dose is used for prophylaxis. So active intervention measure include according to the stratification of the problem, and this is according to the API index, right? So API, what is API index, that we are going to see later. But before that, see what are the vector control strategies. Vector control strategy include anti-adult measures, right? Anti-adult means measures against the mosquito, adult mosquito. It includes residual spray. You can see over here that a person is spraying over the wall, right? Indoor residual spray. Here the drug alpha cypermethrin is used. Previously DDT and malathion was used, but nowadays since many years this DDT has got resistance. So alpha cypermethrin is the drug which is used in indoor residual spray. It can kill the adult mosquito whoever is resting over the wall, and it has the residual effect, means the effect lasts for 6 months. So if any mosquito comes into the contact of that wall, it will be killed. Then space spray, it is used in space. These residual spray are used inside the house, indoor residual spray. Space spray is used in space, right? In air, right? For that pyrethrum extract is used. For indoor residual spray, alpha cypermethrin. For space spray, pyrethrum is used. You may have seen the machine moving in your city or in your village many times by corporation or by Nagarpalika that that go through the road, and it gives the inform of the smoke is generated that uses the diesel or kerosene along with the pyrethrum, right? And this is for the control of the mosquito, right? Genetic control, right? We have seen previously in case of the dengue also. Environmental control, this is the most effective method. Source reduction, this is the first and primary method, that we do not have to allow the collection of the water, so that mosquito will not develop. Do not allow the collection of the water, so mosquito will not develop, right? So eliminate breeding places, management of the water level, right? So leveling of the ground level so that water will not be collected. So source reduction is the most effective method for the control of the mosquitoes. That is anti-larval measure. This previous were anti-adult measure. Chemical control, with the help of the Paris green. I have told you previously also, Paris green can be spread. Then malarial larvicidal oil can be spread over the water collection. Larvicidal fish like this Gambusia finish or lobster or guppy fish. I have told you in dengue also. These are the common larvicidal fish which are used as the biological control. So in anti-larval measures, there are three main measures: environmental control, that is source reduction; chemical control, that is use of the Paris green or that mosquito larvicidal oil; then this fish, larvivorous fish, Gambusia, lobster or guppy fish can be used. You can see this mosquito breeding area here, particularly in artificial collection of the water, mosquito for dengue may develop. But then personal protection. So there are three measures. We have told you that anti-adult measures, then anti-larval measures, then third one is protection against mosquito bite by using the mosquito net. You can see in picture, mosquito net is commonly used, as well as this mosquito net may be also impregnated with that insecticide, that is called insecticide treated mosquito net. And for that, deltamethrin is used. Deltamethrin is the common liquid or common chemical which is used for treating this mosquito net. So if any mosquito, adult mosquito come into the contact of this mosquito net, even they die. If it rests over the mosquito net, because of the effect of the deltamethrin, mosquito will die. Right? Then there is also long-lasting LLIN, long-lasting insecticide treated net. Long-lasting insecticide treated net. Here, effect lasts for 5 years. So whenever this mosquito net is manufactured in industry, at that time in manufacturing material, even deltamethrin is mixed at the time of the manufacturing, so that the effect of this long-lasting LLIN, it lasts for 5 years. Screening of the house, many of used to cover the house, so that like you have seen that we apply some net over our window, right? So that is called screening of the house, so that mosquito cannot come inside. Using mosquito repellent, this may be called mosquito repellent, right? Diethyl toluidamide, indolone, these are the chemical used inside it. Or we can also use that Odomos, that is also mosquito repellent. In this such type of the all out, or you know that Mortine, right? It contains a substance called transfluothrin, right? This is the substance. You can read over your house also in very small letter. You may have to use that magnifier lens to read that label, transfluothrin, it may be written over that. So three chemical, three or more than that, three chemical you need to remember. I have told you that in case of the indoor residual spray, alpha cypermethrin is used. In treating this mosquito net, deltamethrin is used. In this all out or this Mortine, such type of the mosquito repellent, this transfluothrin is used. If you do not remember the name, you can repeatedly play this video so that you can remember that. In case of the space spray, the pyrethrum extract is used. In already I have told you that IRS, alpha cypermethrin. Right? Malaria vaccine, still in research since so many years. We are talking about the vaccine against COVID, but you can see that in dengue, malaria vaccines, they have not been still developed, right? Because of the many limitations. So you just remember that only these names are there: SPF 66 for Plasmodium falciparum and PFS 25, but they are not in practice, right? So they are just under research since so many years, since we were in undergraduate. So measurement of the malaria, how to measure malaria, how to measure that malaria is epidemic or endemic in your city or in your country, by many methods. Just remember the name: inferior urticaria, ERA, spleen rate, average enlarged spleen, parasite rate, parasitic density index, infant parasite rate, and proportional case rate, right? Just remember these names now. We will take in separate lecture about this detail. Eradication area, annual parasite index, that is API. Yes, I will tell you API right now. That is confirmed case during 1 year. Annual parasite index is confirmed case during 1 year divided by population under surveillance. Suppose in a village of 10,000, that is called population under surveillance. 10,000 is population under surveillance. Confirmed case of malaria during 1 year are 100. So 100 divided by 10,000 divided into 1,000 is called API. Whatever the result is there, it is API. Annual blood examination rate. So ABR, ABER, annual blood examination rate. So after passing your UG, whenever if you become medical officer, then these are the most commonly that used terminology during your review meeting. Right? ABR. What is the ABR of your PHC? CTHO will ask you that what is the ABR of your PHC, whether it is good or bad as compared to the previous year. So what is that? That is, the name itself suggests number of slide examined during 1 year, that is annual, divided by population of your PHC into 100. Suppose population of the PHC is 30,000. So here 30,000, number of slide examined in 1 year are 5,000. So 5,000 divided by 30,000 into 100 is your ABER, annual blood examination rate. Annual falciparum incidence, right? And other are human blood index, porozoite rate, mosquito density, man biting rate, inoculation rate. These are other vector indices. These are all called vector indices. Previously, this malaria program was National Anti-Malaria Program. Then frequently the name of the malaria program has been changed. First, there was National Anti-Malaria Program. Then the name was changed to National Malaria Eradication Program. Right? Then national again is what National Anti-Malaria Program. Right? But nowadays, since 2013 onwards, or before that also, this malaria is merged in program called NVBDCP. Remember this name, NVBDCP, National Vector-Borne Control Disease, National Vector-Borne Disease Control Program, in which along with the malaria, you know that dengue, chikungunya, Japanese encephalitis, such diseases are also there. Sandfly disease also, these are there. 6 diseases are there in NVBDCP, National Vector-Borne Disease Control Program. So for malaria control, remember that what is the program? NVBDCP, National Vector-Borne Disease Control Program. So that is all about malaria, epidemiology, prevention, control. Thank you very much. Write down your roll numbers. Yes, you can write down your numbers.